All right. I want to welcome everyone to this webinar, and I'm just going to do a housekeeping slide right now. During the presentation, if you'd like to ask a question, please use the chat feature, which is found on the right side of your screen. And if you're having difficulties understanding our presenter, just please let us know that way as well. This is a reminder that this webinar is being recorded, and we will provide a link to this presentation from our website. I'm going to go ahead and turn it over to our speaker, Anna Strong.
Hey everyone, I'm Anna Strong, and I am the Health Policy Director at Arkansas Advocates for Children and Families. And Arkansas Advocates, we are a nonprofit organization that we work to really make sure that kids and lower-income families have a voice at the Capitol, and as state laws and other things are done that affect the well-being of families. So we work in a lot of different issue areas. I am our healthcare person, but we also work in foster care, juvenile justice. We work in tax and budget issues to make sure that we have the funding available to support the programs we care about. We work in education, a bit in immigration. We also have an office in Northwest Arkansas in Springdale. So we really do try to have a statewide focus and do a mix of policy work and outreach work to make sure that communities around the state are engaged in the well-being of their own community's kids. So some of our big wins that you may have heard, or that we are a little bit more well-known for, are pre-K. We helped secure $111 million for public pre-K in Arkansas. We helped start the Our Kids First program back in 1997. And we helped start the state school breakfast program here in Arkansas. So those are just a few of the things that we do. Lately, we have been working quite a bit in trying to improve access to affordable health care coverage for families through the Affordable Care Act, and that's what we're going to talk about today. So we're going to start. I know there are a lot of different levels of knowledge about the law, and I just want to make sure everybody's on the same page. So we'll start with a bit of a 101 on the Affordable Care Act, and then go into a little bit of specifics at the end, near the end, about children and about mental health. So please feel free to, I'm happy to take questions along the way if they come up through the chat, so just let me know. And I do want to caveat this also. There are licensed people around the state who can help you enroll in health coverage. I am not that person. I did work to set up the frameworks for that, but I am not a licensed navigator or in-person assister, so I did just want to give that caveat that if anyone has specific enrollment or eligibility questions, those would probably be best directed to a different place and not me. So, and I'll give you those resources near the end of our talk today. So what is the Affordable Care Act? A lot of Americans don't know the Patient Protection and Affordable Care Act. It was signed into law, became law in 2010. It was passed by Congress and signed by President Obama. Various aspects of the law we've been working to implement that since then. In 2012, the Affordable Care Act was upheld in the Supreme Court as law. So that is, if you had any questions about that, it is the law of the land in our country today. So. Beginning in October 2013, about 500,000 Arkansans who don't have health insurance today are going to have, they already, do have a new way to shop for, compare, and buy private health insurance plans, and also other programs offered through our state. So we feel, and I'll just, we do take positions on things like this, and we think that the Affordable Care Act is it's a good thing for families. We know that as parents get health coverage, children are more likely to get coverage and the care that they need. So this is something we feel is a good deal for our state and a good deal for families. Now, one thing the Supreme Court decision did, so back in rewind a little bit to 2012, the Supreme Court, it upheld the law, but one of the things that the Supreme Court decision did was essentially make part of the federal law optional, and that was coverage for lower-income families. So essentially what the Supreme Court decision was that every state had the option of whether or not to cover individuals earning below the poverty level in their state. For those of you who don't know, our current Medicaid program does not cover childless adults. It covers parents if you earn less than 17% of the federal poverty level, which is about $3,000 a year of income for a family of 4. and it covers you if you are pregnant or if you have a permanent disability for 12 months or more, which leaves a lot of people in a big gap between Medicaid and what is affordable for private health insurance. I'm happy to say that our state did what I feel like was the right decision. We were the first state in the South to say, yes, we're going to cover lower-income families here in Arkansas. And if we go to the next slide, actually, you'll see that we are still the only state in the South. I think Kentucky was technically kind of undecided in the Civil War, so I don't know that they're part of the, I don't know, they're also part of the SEC, so I'm not sure. But Kentucky and Arkansas are the only states in the South that are covering lower-income families. The rest of the states around us are essentially leaving out lower-income adults. While higher-income adults are going to get coverage through a different part of the law, lower-income families will not have any affordable options any more than they do today. So I'm really proud of our state for doing this. The Healthcare Independence Act was signed in April, and you might also have heard it called the private option. And we'll talk a little bit more about that going forward in this presentation. And I kind of already touched on this, but why does Arkansas Advocates for Children and Families, why do we care about the Affordable Care Act? Like I said, we helped start the Our Kids First program, which really extended affordable health coverage to a lot more children in Arkansas. And I'm happy to report that since 1997, when almost a quarter of children were uninsured, we are down now today to 6% of children who lack health insurance. About 45,000 kids, but we are doing much better than we were 15 years ago. However, we know that, as of last summer, we knew that about 80,000 low-income parents were uninsured. So those are parents of children who have Our Kids First A, and they were kind of the parents that fell into that gap I mentioned. They weren't eligible for Medicaid. They didn't have options for affordable health insurance. And we know research has shown really that the best way to reach kids is to go through their parents. So why do we need the Affordable Care Act? Oh, it looks like this kind of squashed my slides, but that's okay. And I will tell you also, for those I think Chad may have emailed this out, the link to, or he will after the presentation. If you're at your computer, you can go look our big poster up on the Affordable Care Act. It's on our website at www.aradvocates.org. And if you go to the issues and go to health, then you'll see a small version of this that you can click and print out for yourself. But we have a big poster, and this is kind of the gist of it to start. Are some people able to hear? Okay. Just wanted to make sure. Okay. But we know that 1 in 4 Arkansas adults lacks health insurance. That's about 500,000 adults, 500,000 adults here in Arkansas, which makes this not just a health insurance and health care issue, but it makes it this is an economic issue, this is a job issue, this is much broader when we have a quarter of adults lacking health insurance and the basic ability to pay for preventive care and treatment if they needed it. It's an issue. And I also just wanted to mention here that about the average cost for a full coverage family plan in Arkansas is $12,000 a year. That's $1,000 a month. And I know I don't have that in my budget, and I know most Arkansas families don't have that in their budget either. And so if you don't have insurance that's already subsidized through your employer and through, or through another source, such as Medicare or Medicaid, then often insurance is out of reach for families. So the next slide. So I just wanted to also paint a bit of a picture. Low-income uninsured adults, I already talked about the fact that there were about 80,000 parents, but overall, lower-income adults, which is adults earning less than 138% of the federal poverty level, and that's about $15,800 for an individual, $32,500 for a family of 4. So this is adults who are uninsured by county in Arkansas. The darker the color, the higher the uninsured rate. And I will say this map looked a little different than I thought it would in Arkansas, but some of the counties we think of as doing, as the most prosperous counties, for example, Northwest Arkansas, have some of the highest uninsured rates in the state. Sevier County actually ranks at the bottom with about 64% of low-income adults being uninsured there. So So I just wanted to make sure that folks were aware of that and how that was distributed around the state. So why do we need the ACA? Besides the fact that 1 in 4 adults lacks health insurance, we know that medical bills cause about 60% of bankruptcies in the U.S., and health insurance is a big protection from that. You know, even if you had a catastrophic plan that covers you for the major health expenses, that's at least something to protect you from, you know, a $10,000 or $100,000 cancer treatment or an ongoing issue that, you know, needs a very expensive drug. And we think, you know, we want families to be able to support themselves and be able to make ends meet and save for things like a new house or a house or save for college. And so we think health insurance is part of the whole package that helps families be sufficient economically. And lastly, I just want to talk a little bit about some of the current insurance market, I guess, conditions that the ACA helps to change and be more consumer friendly. So we know that this is just one example, and it's related to kids, but we know that the Affordable Care Act required health insurance companies to offer preventive care at no cost to families, and no out-of-pocket cost is wrapped into their premium. And we know that 64% of Arkansas kids have had the same or better access to preventive care services thanks to the ACA. Some were already at that place where preventive care was included. But anyway, I think that's a really good example. In the next few slides, I just kind of detail a few of the other protections that this brings to the insurance market in Arkansas. So some of these were in place and have been in place for a while now. Children under age 19 have been, for a couple years now, protected from rejection due to pre-existing conditions. So the child with asthma, the child who has, some sort of other disability or a mental health condition can no longer be rejected from insurance or have that benefit excluded from their policies in the private insurance market. Children can stay on their parents' insurance plan until age 26, and about 35,000 Arkansas young adults are doing that now. I already mentioned the preventive health services, but look how many, about almost 600,000 people taking advantage of that. No lifetime limits on health on health benefits. So if you have, cancer as a child and then develop multiple sclerosis as an adult, you don't run out of lifetime benefits. And then also the 80-20 rule for insurance companies. This means that insurance companies have to spend most of your 80% of your premium dollars on care or quality improvement. If not, they have to write you a check. I know that our organization has gotten a check back from our insurance company in the past to meet that 80-20 rule. So, and there was also a temporary increased rate for primary care for 2013 and 2014 for some primary care codes through Medicaid, which it bumps Medicaid rates up to Medicare rates, which was really great. And these are new, actually, as of January. These are some of the protections that just kicked in as the law's coverage portion really kind of rolled out. And that is no coverage denials or increased premiums for adults for pre-existing conditions. So that knee ache or that back problem you've had is no longer something that the insurance companies can exclude from your plan in the new policy. Now, if you have a grandfather policy, that's a different story we can talk about another time. But so this is a great news for a lot of Arkansans. There are no longer any annual benefit limits, and that you can no longer be charged more for being a woman or for for being a woman, for being having a pre-existing condition, et cetera. Age, geography, tobacco use, and then whether you want individual or family coverage. Those are the only things that will increase your premiums going forward. So. And then lastly, no more waiting periods, except for Our Kids First B still has a waiting period if a parent drops their health insurance to get on Our Kids First B because it's a more affordable decision for the family, a waiting period of 3 months. And then job-based coverage also can have waiting periods of up to 3 months. So, new coverage is available. So you may have heard of the marketplace or the private option, and we'll go into a little bit more about what each of those is, but generally all Arkansans should have access to affordable, comprehensive health insurance going forward. There are some exceptions to this. For example, if you're incarcerated or if you are undocumented, that this really drastically improves access to coverage for a lot of people. Now, this starts when, sometimes gets me. If you have full coverage, affordable health insurance, you can keep it. Now, we've seen a lot of companies changing their plans, and that is to come into compliance with some of those protections that the law requires. That sometimes comes along with a change in price. I think, we in Arkansas have tried really hard to balance our requirements for coverage and balance comprehensive coverage with price. If your coverage is so comprehensive that it prices people out of the market, then that is not an effective use of that. So we worked really hard in Arkansas to try to make sure that that balance was in line. Secondly, this is what we call the welcome mat effect, which is if you currently qualify for Medicaid or Our Kids First but didn't know you were eligible or haven't signed up, this is the opportunity to get enrolled. You may not have thought you were eligible, but you came to the table for some other type of coverage, and now you have even more affordable coverage than you thought. And I did want to mention, if you don't sign up, you may have to pay a penalty. That penalty is $95 a person in the first year, or 1% of your income, whichever is higher, per person. And except for kids, they're half price, so they're $47.50. And that penalty does go up to $625 a year down the road in a couple years. And there are a couple questions coming in about Our Kids B still back paying services. Let me touch on Our Kids B down the road, but there are some questions we don't know about Our Kids B yet. So let me touch on a little bit down the road. And then another one on chiropractic care. With a pre-existing condition, that should not be the case unless she's in a grandfather plan. So basically the question says, can everybody read the chat? Okay, so the question is, a client receives chiropractic care and was told that her insurance isn't going to pay for it because it's pre-existing until she's had her insurance 1 year. Does this sound accurate? I would say no if she has a new plan. However, some people are still in grandfather plans, and if you have large group plans, so like if you have insurance through your work, through a large group plan, that is a different story. They have a different set of regulations, and also the same goes for if you have a self-insured plan. Like I know some of the big corporations in Arkansas, like Walmart and Tyson, are self-insured, and they have a different set of rules as well. And most of what I'm talking about today is for the individual market. So that would be kind of a specific question that we would need to look into. But in general, there shouldn't be any waiting periods for any parts of anybody's coverage any longer. So new coverage is available, and based on income, this is the great news about the Affordable Care Act. It really does help make things affordable, especially for people who haven't had insurance before now. Based on income alone, 95% of uninsured Arkansans may qualify for financial help to help pay for new coverage, and that comes in two different forms. One would be what's called the private option, which is Arkansas's kind of unique way of extending coverage to lower-income Arkansans through the Medicaid program. And then the other way would be through our marketplace, which has sliding scale fees based on income. And just a couple of numbers so far. So far, open enrollment has been in place since October 1. We've been enrolling people since October 1. Some people's coverage began January 1 if they signed up ahead of time. And so far, we have about 75,000 people who signed up for a plan through Arkansas's private option, which means they don't pay a monthly premium at all. And some will pay copays, some will not, depending on their income, which is great. So these are all newly eligible adults who were not eligible for Medicaid before and who did not have private insurance. And we also know that about 12,700 people have signed up through the federal marketplace with the sliding scale fees, and about 88% have gotten some sort of assistance, and those numbers are hot off the press yesterday. So this is good news. People are getting help, and most Arkansans who are signing up do have some sort of financial assistance here in Arkansas. Our marketplace, as I've mentioned several times, our marketplace will connect you to coverage. So the marketplace is an online marketplace. Some have compared it to Travelocity or Expedia for health insurance. It's a little more complex than that, but it is a place where you can go out and shop for and compare plans, apples to apples, that meet your budget and your health care needs. And I already mentioned some of the financial assistance that's available. The healthcare needs are another one that I did want to mention. The next slide actually lists every plan sold in the marketplace, and this includes the private option or new plans in the federal marketplace, which is at healthcare.gov. That is, every plan in there covers these 10 services. And for this group, I did want to flag number 5, which is mental health and substance use disorder treatment in parity with physical health. And I also wanted to flag prescription drugs, especially for the private option where folks may have been used to the Medicaid formularies or ARKids-B formularies there. ARKids-B is staying the same for now, but I'll talk a little more about that in a minute. But with prescription drugs for the private option eligible individuals will use private insurance company formularies, because essentially what's happening in the private option is that Arkansas Medicaid is going to purchase a private health insurance plan from this new marketplace for lower income adults who would have qualified for our Medicaid expansion. So we did it in a different way. This is not exactly managed care for those of you who may be familiar with what managed care is, where the state contracts with a private insurance company to run their Medicaid program. It's different than that. Essentially, the state is purchasing a private health insurance plan for these individuals in the private option. So we'll get into the who's and what in just a second, so it's coming down the road. So our next slide kind of talks about how much it costs, and that's what everybody wants to know, the big question everybody wants to know. You're going to pay a monthly, you may pay a monthly premium for health insurance. That all depends on, this is all done by what's called modified adjusted gross income, and that's the newest. If that sounds familiar from taxes? It is. But instead of looking at every family and calculating income in different ways for different programs, we're starting to transition to a more standardized way of using just your modified adjusted gross income, or MAGI, to see how much your family earns and what you qualify for. And that depends. So your family will be your tax-defined family, so however you file taxes. And then these other things like tobacco use and other things can cause you to have to pay more for your premium. And so basically, the next slide if you want. Yeah. So how much does it cost? So the great thing about this is right now we have a lot of benefit cliffs. So you qualify up to 200% of poverty, and then you qualify for nothing. So you get help, and then it drops off. And so it's almost a disincentive for you to get that raise or to get a better job or something like that. And one of the things the Affordable Care Act does is really kind of turns that more into a curve. And so as you earn more, you will pay more. You can keep your same insurance plan. If you're on the private option and you get a better job and you then qualify instead for the sliding scale subsidies, you can keep that same plan and just pay a little more every month. And you'll have, and then as you earn more, you'll pay a little more, et cetera. And that financial help extends to individuals earning up to $45,960 a year, or a family of 4 earning up to $94,000. And that's most Arkansas families, honestly. When we have a median income of about $37,000 here in Arkansas, that is most families. So there's one more question that's come in about what will happen to RSPMI as we know it under the ACA. And that is a very, I would say, a big question. So Adam, you have some good questions. And I don't mean to put you on hold, but I promise I'm getting there on some of these things. So I'm just going to finish a couple more things on the basics, and then we'll kind of delve into some of the specifics on mental health. So this is where we talk a little bit about the private option versus the marketplace. So if you earn less than the amount in this table here, and that goes up depending on your family size if you have 5 or more people, but that's 138% of the poverty level. So if you earn less than that, you may qualify for our private option coverage. You can choose your plan from the marketplace, but Medicaid will pay your monthly premium for a health insurance plan. If you earn more than that, you can purchase a health insurance plan in the new insurance marketplace, and depending on your income, you may qualify for a subsidy. So kind of going back to those numbers I mentioned a minute ago, about 75,000 people have signed up so far for the private option, and about 12,000 people have signed up so far for the marketplace, and 88% of those have gotten some sort of help. help paying for that. So this is really good. I think this is, these are kind of the two new options that families have, and I think they all provide a standard set of benefits, and they all have standardized cost sharing. Some families can even get reductions in their cost sharing amounts, depending on their income in the marketplace plans. So even if you do have a copay or a deductible, if you're below 250% of the poverty level, which I don't have that written down right in front of me, but you can get reductions in how much you might have to pay for deductibles and copays as well. So it really does try to make sure that this insurance is affordable and that families are able to deal with the short-term costs. Okay. So when should I sign up? Now. Open enrollment began October 1. I'm sure everyone has seen the news that the federal healthcare.gov rollout was not as smooth as everyone would have liked it to be. This happens with a lot of big technological rollouts, from Google to Apple to other things. So healthcare.gov was no exception, and it is working very, 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 very much better now. And hundreds of thousands of people have gotten signed up. So some people, if you signed up before December 23rd, your coverage began January 1st. If you sign up by tomorrow, your coverage will begin February 1st. So, but in general, you have until March 31st, 2014 to sign up for marketplace plans. I will say private option eligible families are eligible year-round. And this is one thing related to that Our Kids B question that I mentioned about, will Our Kids B still back pay services rendered during a 3-month wait period? If you have the private option, that will back pay for it has 3 months of retroactive coverage and will cover you back until then. It also covers you in the intermediate time before your private plan kicks in. So there is good back pay coverage for Our Kids First and for the private option plan. If you want to learn more, there are more than 500 local assisters around the state who would be more than happy to come to your clinic or come to your PTA meeting or come to your church and talk about what's going on with health reform in Arkansas and what new coverage options are out there. There are people at every health department, every local health department in the state, as well as a host of nonprofit organizations, our state's Minority Health Commission. We have people who work in housing, people who work in substance abuse, all kinds of different places where we might find families and individuals who don't have health insurance. So I'm really excited about also community health centers are part of this as well. And those people can help you enroll, but they can also come to a presentation on what's going on and how to sign up and who the people are in your county that can help you. Local hospitals and other clinics also have people on staff. So all these people will be licensed, and they will have a license from the state of Arkansas that says you've been trained. Our in-person assisters have been through 70 hours of training on this and how to sign people up. So, I think we have a lot of really well-trained people out there. So, the next slide, these are the resources you might want to know. And I do want to mention that it is not legal in Arkansas to conduct the duties of a navigator without a license. So signing people up as part of your job or, doing outreach that is very specifically geared to, getting people to come in your door would be something that you would not want to do. You would want to engage a trained and licensed navigator or in-person assister to do that work for you. We do have a question also about when you're turning 26 and losing your parents' insurance, how far ahead of your birthday should you sign up? If you know, let's say my sister-in-law actually is turning 26 on March 1st, and so she will lose her parents' insurance. She's in law school, and so she will lose her parents' coverage at the end of March because I think she's covered through the month at her birthday. And so she will lose coverage on March 31st. And so she would need to sign up before March 15th to have coverage that starts on April 1st. Generally, if you sign up before the 15th of a month, your coverage will begin the beginning of the next month. If you sign up after the 15th of a month, it will be the next month. So it can be up to 45 days before you get coverage, somewhere between 15 and 45 days. If you do qualify for the private option, you can get coverage back 3 months, though, so that does give you temporary coverage. So that's a really good question. These websites are the places to go. Our AR Health Connector is the Arkansas outreach effort. It's housed at our state's insurance department. If you go to that website, click the big green easy button, because our legislature stalled funding for outreach, so we had to do some workarounds from the private company that was doing a lot of our educational and media work. That was all stalled or stopped in the legislature, so that has now been transitioned to the few state government workers who are doing this. So click the big green easy button on that website or call the number listed there, 1-855-283-3483. That is where you can talk to someone in Arkansas who knows what's going on here. You can also, healthcare.gov is a really great place to go. If you know someone is lower income, if they, for example, qualify for SNAP, for Supplemental Nutritional Assistance Program, formerly known as food stamps, or if their child qualifies for Our Kids First A, the adults might want to go to just apply directly through accessarkansas.gov, which they should be familiar with if they have these other benefits. And InsureArk is a place where private option eligible persons select their private plan. I know it's a lot of different websites. We're hoping down the road that this gets streamlined. A lot of the challenge in Arkansas right now has been in really creating the law's no wrong door, vision of a no wrong door system where you can go in through any door. So any of these will get you to the right place, but it just may be a little bit more roundabout way and may take a little longer if you don't go directly where you qualify first. So because the private option is run by the state's Medicaid program and the state's insurance department, even though you're buying a plan from the federal marketplace, so all the federal eligibility work is done at the federal level. Okay. I have another question from Adam. Do we need to instruct the people we serve that would qualify for the private option to log onto the marketplace prior to March 31st if they already have active Our Kids? So nothing is changing with Our Kids First. And I will talk about that. I'll just go ahead and talk about that now. So our next slide says our new landscape. This is just kind of recap. Our new landscape, all Arkansans can access comprehensive, affordable health insurance despite pre-existing conditions or other barriers, with the exception of a couple that I have listed on that slide there. I know one of the things that was part of the private option law. You know, I'm looking at my little handout here, and let's do one more slide, and then we'll talk all about the private option in kids. So, and this is just also recapping. Everybody has to have health insurance. The cost of insurance will be reduced for most people. We've already talked about these things. These are just the high points. Even a lot of people about half of people buying individual policies already in the market. Like, I know my parents buy an individual insurance policy. My dad is self-employed. They are eligible, many of those are eligible for a subsidy. And there is a penalty for most people who don't enroll, and all these insurance plans cover those 10 essential health benefits, and we are working really hard to build an affordable plans in a competitive marketplace. So anyway, next plan, let's talk about kids. So the private option, when we're talking about adults, that brought coverage to adults who were not eligible for our state Medicaid program, and adults who were not able to, they were lower income families, most of whom were not able to afford private insurance or didn't have it offered through their job. One of the things included in the private option law, and you know, this one is a little more contentious for us here at Arkansas Advocates, but one of the things included was the intent to transfer children who are on Our Kids First B into a private option style of plan in 2015 or beyond. So what that means, Our Kids First B are children earning, as of January 1st, they streamlined eligibility for all children of all ages on Our Kids. So Our Kids A is at below 138% of poverty, and Our Kids, or did I say that wrong? Our Kids A is below 138% of poverty, and Our Kids First B is 138% to 200% of poverty. So you have these kind of two different categories of Our Kids First. Our Kids B, so those are the higher income families. Those kids would have parents who either have job-based insurance or who have plans in the marketplace already. So the idea was to allow a family to get coverage together if the parents and the child are getting coverage through the marketplace. There are a lot of things. So Our Kids First is not going away. Our Kids First, the eligibility limit stays the same. It is still going to be at 200% of the poverty level, but it will just be delivered in a different way. So instead of a child having Medicaid pay directly to the providers, Medicaid will purchase a private health insurance plan for those children. And I will say there have been a few pretty detailed questions on here. We don't know any details on this yet. We are still trying to get the private option implemented. That we will have to do all of this through a waiver that DHS will submit to the Federal Health and Human Services Department, and we do not have any information on this yet. So I know one thing, and that is that Arkansas advocates will be here very closely monitoring this and making sure that children do not lose access to any benefits, that their cost sharing does not go up, so that means their co-pays and deductibles, and that they do not lose access to care. One place that we have already been identified as a potential hiccup and a potential issue would be school-based mental health services. Because right now Medicaid does, and a lot of providers, especially outside providers like many of you all who come into schools to provide those services, some of the providers that are providing those services may not be recognized by private insurance companies as billable persons. They may not have the advanced degree required. And in a lot of parts of the state, there may not be people with those degrees to fill the gap. So that is an access issue for us that we see. We want to make sure that that school-based health centers are also able to bill. The challenge is generally that private insurance companies do not pay for services rendered in a school environment. With the school as a site of service. So if you're an outside provider coming in, you can bill as your clinic coming in potentially, but if you are, there are a lot of school-based mental health providers who are employed by the school district, about 50, I believe, in our state. We're going to have some kinks to work out with that to make sure that they're still able to provide those services to their children. So long story short, Our Kids First B, which is we're thinking about 60,000 children will have their coverage transitioned in 2015, assuming the federal government approves our waiver. We'll have their services transitioned from Medicaid fee-for-service into a private insurance plan, and they will have to meet the requirements of that plan. So that transition would happen automatically. So we had a question about, do we need to instruct people that we serve that would qualify for private option to log on to the marketplace? Yes. Do kids need to do anything? No. Kids do not need to do anything right now. I would say adults, if you're eligible for the private option, then you can sign up year-round. However, we would really like to get as many people signed up as soon as possible, just because the more people we have in this marketplace, the better it works. So anyway, so those are some of the things about kids. One thing we would really like to see happen is an end to the Our Kids First waiting period for Our Kids First B. That is something no other population has waiting periods, and we don't think it's very fair to make kids have one. We also, right now, immigrant and Marshallese children who are here lawfully have to wait 5 years. If you're if you're a qualified alien, which a lot of immigrant children are, you have to wait 5 years before you can get on Our Kids First. If you're a Marshallese family, you're a different kind of, you are a compact of free association migrant and will never have Our Kids First eligibility. However, there's a simple change Arkansas can do that 25 states have already done that would allow them to be eligible immediately. So we think that would be a really great access opportunity for kids. So these are some of the things that, that with this transfer of children into private option plans down the road, we need to keep an eye out for. We need to make sure that their access is not going away because of this change. And so we will be making comments at the state and federal level as we are as we see that these changes are happening. One of the downsides to waiver amendments, so the private option was done through a waiver with the federal government. that has a very clear public comment and public input process. Waiver amendments do not have that at all. So we are trying to do our best to make sure that we're getting as much information ahead of time as possible. So, okay, next one. What about mental health? This is a big question, and I think y'all are probably going to have a lot of questions, I hope. And I may or may not know the answers to all of them, but I do just want to mention a couple things to point out about mental health. Parity on the new plans. So this is not large group plans like through employers, but these new plans through the marketplace and the private option will have mental health and substance use disorder services provided in parity with physical health. So that is really good news. And actually, new parity regulations came out right before Christmas, I think, and I actually have a call on that tomorrow. So I'm excited to hear a little bit more about those regulations and what they mean. I already kind of mentioned as well reimbursable clinicians. Getting private health insurance companies to expand the clinicians that they reimburse for mental health services is going to be probably a pretty important priority for school-based health services. So, oh, sorry, somebody asked what parity means, and I didn't say it. So, in parity means they have to be offered in equal amounts too. So that means that if you offer no visit limits on health services, you offer no visit limits on mental health services. If you offer a $40 copay on physical health specialist services, you offer a $40 copay on mental health services. So that's kind of the way, that's what parity means. And if you have any other questions about what that means specifically, let me know. Type in another question. And thank you for, I'm sorry I didn't explain that. I appreciate you asking. The reimbursable clinicians, I know, I think some of the ones, and I may get these acronyms all wrong, but I believe, I'm not even going to guess, some of the non-master's level clinicians, we'll just say that, are not currently recognized by private insurance companies. And I guess it's an LIC, I'm looking at
Licensed accredited counselor.
So would that be a non-master's level? So that does mean that we would like to see some of those people who are providing those services under the supervision of a reimbursable person under private insurance, that they are LIC, thank you, is a master's level licensed associate counselor. Okay, and LICs and LMSWs are master's level, just not independently licensed. Thank you all for clarifying this to me, because I'm great on the ACA side of things, less so on all the specific licensures for mental health. But I will say that those are those lower level that require supervision are not currently all recognized by private insurance companies, and that would be something we would love to see happen for the requirements for this private option, so that we don't see kids losing access to services. Okay, MHPP, okay. Oh, this is great. So, we just got one more question. What do I need to do to be a reimbursable clinician? Do I need to sign up on insurance panels, or will this be automatic? That is a really great question. And a couple bullets down, my billing point right here, if you are not billing private insurance, you better start moving that direction. You have about 500,000 people who are getting private insurance plans in Arkansas who will have now a payer source that did not before, and they will all have private health insurance plans for the most part. So to do that, you can, and I actually just learned this last week, you can go to the private insurance companies are Blue Cross Blue Shield of Arkansas, Blue Cross Blue Shield, there's a multi-state plan, but you can call just the Blue Cross Blue Shield Arkansas to get to both of those. So it's, I think it's ARC Blue Cross or Arkansas Blue Cross. But you can go to their provider relations, and you can ask for an appointment with one of their network representatives, and they can get with you. Qual Choice is the second one, Qual Choice, QCA. They also have the same thing. Go to their website, request a meeting with their provider relations persons. And then the third one is AmBetter. That's AmBetter, AmBetter of Arkansas. And AmBetter of Arkansas is new to the state. They were one that we helped draw in with our private option decision. And they have the same thing as well. You go out there and you look for their provider, their network or provider relations person, and they can they can get you the information you need to become a licensed person that can bill for private insurance. So, and that is something I would encourage everyone to do, just heading into this kind of new world where we have more private insurance than we've had in the past here in Arkansas. So, the only other thing I would mention here, formularies are more limited typically on private insurance. Medicaid is not doing a wrap for those right now. So, and I assume the same would be true for our Kids First B. So, potentially, we don't know yet. But as people are getting coverage through private health insurance plans, those formularies for the private insurance companies are going to be very important. You can go look at those actually through either healthcare.gov. You can go look at the formularies for each plan. If you can go shop without signing in or anything, and you can go out and look and see what the formularies are, what the networks are for those plans, et cetera. And I will say regarding the networks, no plan in Arkansas, so those three, Arkansas Blue Cross, Qual Choice, and Ambetter, none of them actually initially met network adequacy, which means are you contracting with enough people statewide in the areas you're selling insurance to have mental health and parity of physical health? And a lot did not meet those requirements, but they stepped it up a bit in order to get there. So they are making an effort. The insurance companies are making a strong effort, I think, to try to make sure that they have a strong network out there for folks. And lastly, TEFRA, I figured I would get questions about this. There are no changes to TEFRA that I know of at this point in time. TEFRA, pregnancy, Medicaid, a few others are currently in the on the list of Medicaid programs that have not been ended, but I wonder if they may be revisited down the road, and by down the road I mean 2 to 3 years down the road. So we definitely want to keep an eye on that. And make sure that nothing is happening that we don't feel is in the best interest of the people we work with. So, all right, and that's really, and I put the websites on there. I didn't even have to tell you all those. So these are the websites where you can go for more information to find out about becoming part of their network, to find out about what their formularies are, what their networks look like, et cetera. You can also, as I said, go to healthcare.gov and just look at the plans that newly insured people are going to have out there as well. So those are a really good way to go. And then our website, aradvocates.org, that's where you can find the big one-pager that a lot of the slides today were pulled from. That's something that I know some clinicians have put up in their offices to kind of start conversations with families about getting covered and about getting health insurance. And I know that has worked well for some. So that might be something. I have them if you would like them. I'm happy to send them some your way. So just shoot me an email. My contact's on the last slide. And I did just want to mention a couple of things. I want to leave the next 10 minutes for questions, but one more slide. There we go. Next steps. I just want to mention some of the things that are down the road. So coming up next month the private option must be reauthorized every year, with 75% of our legislators in the House and 75% of our Senate members approving it, which is a very, very big hurdle right now. It was a very contentious vote. We had 3 votes to spare to get it into place in the first place. And then we have to reappropriate that money every year to DHS to spend to cover those lower-income families in the private option. This is a big deal. It happens again in February. It is going to be very, very, very close. If we do not reappropriate it, the people who just got coverage, many of them will lose it come June 30th. So that is something to keep an eye on. So there's that. We need to improve our enrollment system. I already kind of mentioned that, a bunch of different ways in and out of this. And then also this waiver that I mentioned that kind of outlines how we're doing the private option. It's only approved for 3 years, so we have to figure out what happens after that. Right now it's fully federally funded. After 2017, Arkansas will have to start chipping in about 5% to 10%, which is great compared to what a regular Medicaid program costs, but still it will be something the state will have to figure out. So, and then also I mentioned changes being made to traditional Medicaid, that all the programs that have been in place for years that we may not know. So those are just some of the concerns. One question over here, will we receive a copy of these slides? I would assume yes. One area your agency could possibly advocate for is to get more licensed insurance companies to credential licensed psychological examiner independent master's levels that would be great. And, you know, I will say that is a good place for you to advocate as well. Coming from me, it makes sense in some ways, but it also helps when we work together. So if you have any thoughts on these things, I would be happy to talk with someone and with you about this and get in touch with me. And you can actually go to the last slide, which is my contact info. There's my contact info. One more, will PCP referrals be required for private option plans like Medicaid RKids currently requires for children who need mental health services? That is going to be up to each of the private insurance companies on whether or not the private option will require referrals. And I am not off the top of my head sure of the answer to that, but it would be something that any of the provider relations persons could tell you the answer to. Oh, and I skipped one. How does this affect the ability of people to get assistance for inpatient mental health and residential care? That's a really good question. So I believe most of these plans cover outpatient, partial, inpatient, so I guess that would be like residential, or that would not be residential, that would be like a halfway house kind of, I don't know what the technical term is for that. And inpatient and residential care, I know, are covered services. And again, I hate to be, there is what we call a benchmark plan in Arkansas that I know these do all cover some sort of inpatient and outpatient services. And these will be covered at potentially a higher reimbursement rate than traditional Medicaid, which could help improve access. It helps providers, you know, incentivizes providers to take patients. But anyway, so that being said, I think, you know, this is a good question. Again, I am not on the ground, so these, so very specific questions like that, I think are something you want to talk about with each insurance company that you are working with. So. I will send out to, I'll send Chad there's a document that the insurance department did for marketplace and private option plans that kind of gives a review of the mental health and substance use disorder services. It's wrapped in with habilitative services, which is a new one for persons with developmental disabilities. But that being said, I will send that to you because it kind of gives a little bit more of a description about the scope of what is being covered by each plan. One other thing I do want to mention too, medically frail. So for the private option, as part of the private option enrollment, so this is for the lower income families that Medicaid is purchasing the plan for, a private insurance plan for. As part of that, you will take a health screening, and they're expecting about 10% of people to enroll in what's called the to be determined medically fragile, and they will go into traditional Medicaid. And traditional Medicaid will be governed by whatever traditional Medicaid covers, including the things that are hopefully coming from the behavioral health transformation, which y'all can learn more about on the Arkansas Payment Initiative website. If you haven't heard about that, I'm sure it'll be a good future webinar. What about RFPMI changes? That, to me, is a very broad question, and I would probably need you to be more specific about what changes you're asking about. And if this is about Medicaid or anything else, that is not quite as tied to the new plan. So I would need a little bit more specific question on that.
Thanks, Anna. We can maybe just a couple more minutes. Y'all have asked a lot of great questions. We will. Hopefully the recording goes smoothly, and we'll post this up on our website for you all to watch in the future. So we'll maybe stick around for just a couple more minutes to answer any other questions. Otherwise, thank you all for joining.
Oh, a tier system for mental health. Yes, a tier system for mental health. I don't know if that's RSPMI, and that might have been the question asked earlier. So this tiered system for mental health, so that is for all behavioral health and offered through Medicaid, traditional Medicaid. And so I would encourage you to go, I think it's paymentinitiative.org, arkansaspaymentinitiative.org maybe. I know Paula Stone and Marquita Little at DBHS and DHS are kind of the people, they've been out doing a great job talking to groups all around the state about this, and I know that they can provide more information. There's a good a good slideshow available out there that kind of talks about the different tiers. It's a 3-tiered system for behavioral health homes and what people get, but it also drastically expands some of the home and community-based services that people are eligible for. So that is a whole separate topic that I would not be the presenter on, but I have seen it a few times, and it's a lot of really good information, and that is going on along with ACA. Okay, one more question. Will the medically frail be expected to complete the medical survey and mail back to DHS? So that should be, so if you don't complete the survey, then so here's what happens. So you get determined eligible for Medicaid. It's a 2-step process. So step 1 is you're determined eligible for Medicaid or the private option. And step 2 is enrolling in a plan. So DHS basically mails people a letter that says you've been determined eligible for Medicaid. Go to insurearc.org and pick your plan. You have 12 days to do this. So if you go to InsureArc and pick your plan, you will fill out the medically frail screening online, and then you will pick your plan all at the same time. If you do not go out to InsureArc within 12 days, DHS will automatically assign you to one of the plans in the marketplace. And so you will get one of the 3. They all offer similar benefits. You all would see probably more differences than I would, like on the reimbursement side. But anyway, so that is how that happens. So if you don't take the screening, you still can get a plan. If you do take the screening, you do not have to mail it back. It's all done online. So.
Okay, thank you, everyone. We are going to have to go. So if you have, I will send an email out to everyone with slides and the handouts, and if you have any other future questions, I'm happy to pass those along to Anna and her group and all the good work they do over here. So thank you all so much, and have a great day.
Thanks, y'all.